So there are a lot of things to learn about suctioning, including the steps for the skills themselves. But what we really want you to get here is the nitty-gritty basics and the most important things you need to know about suctioning your patients. Now, the primary reason for suctioning a patient is to remove these respiratory secretions to get that airway cleared. Now, it might be that we're removing them for a sputum culture, but either way, we're removing secretions. Now, we can do oropharyngeal suctioning for someone with excessive saliva or oral secretions. We can even do this through an oral airway if necessary, if the patient's unconscious. Then nasopharyngeal suctioning allows us to get a little bit deeper into the back of the airway. And so we use this for excessive nasal drainage, or if for whatever reason we can't use the oral route. Maybe the patient is biting down, or maybe they have had their jaw wired shut and we just don't have access to the oral route. If that's the case, the nasal route comes in handy. The other thing is if they're going to get more frequent suctioning, then we'll use a nasal trumpet, and that will just help us to decrease any kind of trauma or damage to the nose while we're suctioning them. Now, if the patient has an endotracheal tube or a trach, then we'll suction those to help keep them clear and possibly help the patient if they can't cough effectively on their own. So we use a small suction catheter or possibly even an inline catheter that we'll show you in just a second. And it's going to go down just beyond the end of the tube to suction out any secretions that are in the airway. A lot of times it can also make them cough, but that's okay. It's actually going to help us get more secretions out that way. Of course, there's risks with any procedure, but these are the ones you need to have in mind when you're suctioning your patient. The first is hypoxia. I mean, essentially, we are blocking their airway for a few seconds, right? So one thing we can do is we can give them extra oxygen before we start. And the other thing we do is we limit our suction passes to less than 10 seconds at a time. And that just gives them a chance to catch their breath and reoxygenate. Now, the second risk is that it's possible that if we go down and we make them cough, we could also stimulate their vagus nerve, and that can cause serious bradycardia. It can drop their heart rate. So again, we're going to limit that suction time to 10 seconds at a time so that we don't overstimulate that nerve. And then finally, we're applying suction to a really sensitive area within the oropharynx. And so we don't want to cause any damage to these mucous membranes in here. So if we do that frequently, or if we're doing it too much, we can actually cause problems. So what we'll do is we'll limit to 3 passes at a time, and then we'll let the patient rest, and then we'll try again. So some of the equipment that you'll see used for suctioning includes the regulator, like you see here. It's usually attached to the wall in the room, but there's also things like portable suction machines for transport or on ambulances or even at home. And then they'll also need suction tubing, which you can see here. And then this plastic device is called the Yankauer. Now, you'll also hear Yonker or Yanker, but officially it's Yankauer. So we'll use that for oral and oropharyngeal suctioning. We also could use it to elicit a gag reflex. Just don't do that with the suction going. Then we have small suction catheters like the one that you see here, and we'll use those possibly in nasal trumpets. We'll possibly use them in endotracheal tubes as well as trachs. One important thing to note is that these suction catheters are sterile. Suctioning an ET tube and a trach are both sterile. So we need to keep that in mind and make sure we're using the appropriate gloves and the appropriate equipment. And then finally, there's setups called Ballards or inline setups. Now, Ballard's just a brand, but you may hear people refer to it that way. It's a closed suction setup system like what you see here that allows for repeated suctioning of an endotracheal tube or a trach without having to open up the system. If you open the system, you're going to potentially introduce bacteria, and you have a risk for VAP, ventilator-associated pneumonia. So being able to repeatedly suction this patient without opening that system is much, much better for the patient. You'll see this mostly in ICU. So when you learn the specific skills, you'll learn how to perform each type of suction, but we want to give you general rules that have to be followed for all types of suctioning. The first is to make sure that you have the right size of equipment. If you have a nasal trumpet that is a 12 French nasal trumpet and you have a 16 French catheter, it's not going to go through there. It's going to be too big. So you need to make sure you have the right equipment to do the suctioning you need to do. Then we're going to use medium suctioning of up to 200 centimeters of water. Any more than that, and we really risk causing damage to the tissues. Now, the other thing that can cause damage to the tissues is if we suction right up against them. So if we come back into their throat and we meet resistance, we'll actually pull out a centimeter so that when we suction, we're not right up against the back of the throat. We can cause a lot of damage that way. Now, we also will insert this suction catheter without applying suction. Then we suction intermittently. So suction, suction, suction with rest in between on the way out of their airway. And what this does is allows us to prevent from kind of catching on any of the tissues or catching on the mucous membranes. That way we're, again, not doing any damage. Now, remember, we limit our each pass to less than 10 seconds at a time, and we go for no more than 3 passes. We want to decrease the risk of hypoxia and decrease that stimulation on the vagus nerve. And then if we need to, we will hyperoxygenate or pre-oxygenate as needed so that we can prevent that hypoxia issue. So it's super important to remember these nursing concepts when dealing with a patient who requires suctioning. We need to make sure we're monitoring their SpO2 and their oxygenation status. We'll also listen to their lungs before and after suctioning to make sure that we're being effective and getting those secretions out. And then we also need to consider safety and clinical judgment. We need to use the right size equipment, choose the right equipment, follow the rules, and prevent any complications like hypoxia or tissue damage. Let's recap. Remember that the whole goal here is to protect the airway. That might mean using an artificial airway like a nasal trumpet or an oral airway just to help you get access to and clear out those secretions. Make sure you're choosing the right equipment and that your suction regulator or machine is working properly. This should actually be part of your safety check at the beginning of your shift. The last thing you want is to get into an emergency and be stuck not being able to suction your patient because your regulator's not working. And then remember to follow the rules to prevent hypoxia, prevent that vagal stimulation, and prevent any damage to the mucous membranes. So those are the basic rules of suctioning a patient's airway. We hope you learned something and can be confident when it's time to suction your patient. Go out and be your best selves today. And as always, happy nursing.